Assalamualaikum and hi everyone. We are from Group 3. We will be presenting about the application of social media in health informatic perspective during COVID-19 incidents in Malaysia. To know how usage of social media can be implemented in health informatic perspective, we need to have a general understanding about what is social media and what is health informatic. So, social media is actually an interactive digitally mediated technologies which can be in the form of internet-based application and website. Existence of social media will enable us to have a medium for social networking and media sharing. The main principle of social media is that they allow users to create content and exchange it among the users. Health informatics, on the other hand, is a branch of science and engineering that apply informatic field to healthcare, which the main purpose is to improve healthcare. As we can see from the statistic, the usage increased rapidly from 2004 to 2018, and nowadays, social media has become like a secondary identification for every individual, which shows how important it has become. So it is only right for us to take advantage of the usage of social media to bring benefit in healthcare. However, some might also be disadvantages, for example, like sharing of fake news and confidential information.
Some examples of social media used during COVID-19 in Malaysia include Facebook and Twitter, which are part of social networking platforms, and also media sharing sites such as Instagram and YouTube. These applications are used by government through Ministry of Health, healthcare professionals, and also netizens to spread information and also increase awareness on COVID-19 infection, along with giving moral support to those who are affected by this pandemic.
Present about the advantage of social media can promote health acts. My Sejahtera app, which was developed, can provide COVID-19 health guidelines, information on the nearest health facilities, and a COVID-19 hotspot tracker. Next, latest information regarding COVID-19 can be consistently delivered by MOH through press conference or media statements. Official information and local updates on the disease also were broadcast via press conference and regular messaging. The significant role is that it delivers a communicative message to the public during the MCO, specifically in urging people to stay home, practice good personal hygiene, and observe social distancing when in public areas. Public health departments also use them to communicate and exchange information during public health emergencies. Real-time content analysis is provided by Twitter to acknowledge the public health authorities to answer the queries of the people quickly. Lastly, it also educates people on how to avoid misinformation during COVID-19 pandemic.
Good day everyone. I'm going to brief about how social media provide guidance to public during COVID-19 pandemic. The first one is infection control and prevention. The social media, as an example like YouTube platform, providing videos of the standard operating procedure of COVID-19 and the preventive measures like wearing masks and always sanitized hands, and also how social distancing and quarantine helps in breaking chain of infection. The next one is virtual hospital. This is like telemedicine, virtual visit, virtual care, or e-prescribing using video call appointment by providing useful medical advice to keep stable patients at home. Other approaches like chatbot in Telegram for risk assessment of COVID-19 symptoms. The last one is digital support. This is to cope with isolation or quarantine by providing support from healthcare professionals from live video post or support chat service. As an example, it can be for the case of mental health during this pandemic of COVID-19.
Hello, I'm Naiem. I will be explaining why it is easier to use social media for publicly update information, especially in health informatics. First, social media is easy to use, either post information or search for information. Second, it is common things to do for public, see and update information in social media. Third, each social media application have their own notification, make us more aware on updates. Last but not least, we all spend more time on social media than any source of information. These are examples of social media used for updating information, such as Instagram, Twitter, Telegram, and YouTube. You all can check it now. Thank you. That's all from me.
Next, the social media application can also prevent pandemic spreading. Providing online communication is an alternative in avoiding face-to-face interaction among people. For example, work from home has become regular routine among workers in order to prevent direct contact between them, which
might increase the risk of COVID-19 infection. In addition, social distancing such as staying 6 feet between each other and home quarantine have turned into a trend. This action further promote in lowering levels of fear and anxiety among public, as more people tend to stay safe at home instead of being outside.
Assalamualaikum, my name is Binti Hussain, and I'm going to talk about fake news and false information about COVID-19 online. So first of all, false information online are already part of the main cybersecurity issues in this region. This is especially during election periods and times of crisis such as COVID-19 pandemic, where there has been a rise in fake news globally and especially in the age of social media. In Malaysia, up to 11 June, 266 investigation papers on fake news related to COVID-19 has been opened. Moreover, false information circulating on social media also became a catalyst for hate speech towards foreign workers, refugees, and immigrants. During this period, WhatsApp and Facebook were the most popular media through which false information circulated, while the most popular type of false information was related to some sort of authority action and community spread in Malaysia. So this is the top 10 fact check with the highest views and its corresponding type of false claim.
Next, the challenges is sharing of personal information of patient, which can lead to infringement of privacy and confidentiality. Usually, sharing this information happens through social media to gain popularity and involve patient that has high popularity, such as public influencer, artists, or even minister. The infringement also involves tracking patient activity on online conversation and online website. This kind of infringement can invade patient privacy and confidentiality. Patient also had to deal with fake news and inaccurate information which arise from sharing information of patient. Lastly, the discrimination in community also can happen if patient had disease such as COVID-19.
Other challenge, information sharing in social media can lead to stigmatization and harassment to the patient. Stigma in COVID-19 cases happen through unknowledgeable and untrustworthy information sharing in media social about how the COVID-19 spreads, the speculation to blame someone, and the rumors and myths that put fears and anxiety to society. Stigma is the actions of labeling, stereotyping, discrimination, and other negative behaviors towards others. This way of treatment can negatively affect those with disease as well as their family, friends, and communities. People who do not have disease but share other characteristics with this group may also suffer from stigma. Stigma hurts everyone by creating more fears and anger towards ordinary people instead of focusing on the disease that is causing the problem. Stigma can also make people more likely to hide symptoms or illness, keep them from seeking health care immediately, and prevent individuals from adopting healthy behaviors. This means that stigma can make it more difficult to control the spread of an outbreak.
Overcome the challenges during COVID-19 in Malaysia. For the fake news and false information, the Malaysian Communication and Multimedia Commission has developed website sebenarnya.my that allow the public to fast-check all valid information. Besides, individuals who disseminating fake news or false information have been subjected to a legal action, and also increase awareness among the public on their ethical duty to be responsible for what they share on social media. Patient personal information must not be disclosed to the public. This can be avoided by increasing awareness among the public to prevent them from sharing unnecessary personal details of patient and affected individuals. Stigma and harassment. This can be avoided when people become aware of their attitudes and behavior before speaking or posting sensitive statements. And also, we should give them support mentally and physically to the patient or to their relative instead of blaming others. Last, to avoid discrimination during COVID-19, the people must stop citing the name of the clusters according to nationality, ethnicity, religion, or occupation in the social media. Conclusion, social media is the fastest medium to disseminate valid health information regarding COVID-19 to enhance public health during the pandemic. it should be utilised efficiently by Malaysian authorities and citizens to provide knowledge and control the issues during the pandemic of COVID-19.